Hello. Hello, everybody. I think I'm live now. Um, so I'll just get started then. Hold on, let me just check. Okay. Okay, so hello, everybody. Welcome to this webinar. So this webinar is all about medical school interviews. So a little bit about me, first of all. So my name's Nainesha. I'm one of the presenter scholars, and I'm a medical student at Manchester. And so today I'll be talking to you about medical school interviews. So I'll be talking about my experiences of medical school interviews back when I applied in 2012, and then what my friends have said, and speaking to applicants. And then I've also had the chance this year to be involved with medical school interviews myself. So I've had a chance to see what makes candidates really stand out. So hopefully I'll be able to use all of these experiences to give you some tips to know what you're to do really well in the interviews, and to know what's going to come up, like to not know what's going to come up, but just to prepare for it really. If you have any questions at any point, then just pop them in the Q&A, and Dr Yates is live as well, so she'll be able to answer any questions as we go along, and I'll go through them at the end as well. So hopefully this will be helpful for you. So what I'll be talking about today is going through an overview of the types of medical school interviews. So talking about traditional interviews and MMI interviews, and then going over some of the basic topics that come up commonly, and how to prepare for them. And then finally, just some tips and advice. Yes, just some general hints and tips. So first of all, a bit about me. So I applied in 2012, and I applied to Newcastle, Manchester, Hull, York, and St Andrews. And I was lucky enough to get interviews and offers at all of them, which was completely unexpected. And back when I did it, a lot of them had, a lot of mine were panel interviews. So we'll go over what kind of panel interviews are. And although things have changed slightly since then, a lot of the themes are they still ask you the similar types of things. So hopefully we'll go through that today as well. So first of all, what type of interview will you have? So it's either a traditional interview or an MMI interview, and you'll find out either it'll be on the medical school website or it'll be in the emails, and that's the best port of call really, for getting all the information, because you might hear from other people, you might read on the student room about how their interview went, but you need to go by what the information that the university have given you. And usually it's quite helpful, particularly some of the MMI interviews. A lot of universities, they give you kind of a rough thing, roughly of what each station is going to be. So there'll be like an ethical scenario, or a communication skills, or testing your dexterity or something. So they're usually quite good at giving you information for that. Obviously it does help to talk to people, so who have had the interviews, or but when you do that, just take it with a pinch of salt, because you're not actually allowed to disclose anything what actually you were specifically asked in the interview. So it's useful to get a rough idea of kind of how it went for people, but take it with a pinch of salt when people are telling you particularly horror stories. So first of all, we'll talk about traditional interviews. They're called traditional because traditionally most medical schools use this kind of interview, and what it means is that there's a panel, and usually there's 1, 2, or 3 interviewers, generally people who are involved in the medical school for teaching. And then they ask you questions like, why do you want to do medicine? What are your experiences? That kind of thing. Some of them can be quite structured. So one of the panel interviews I had, they asked me 10 questions, and there was 10 set questions. So they didn't ask me any follow-up questions, and I knew that it was going to be a 20-minute interview and there was going to be 10 questions. So I had to play it so that I gave about 2 minutes for each answer. And that was quite difficult to know how you did, because they couldn't really show that they were interested by asking you any more questions. And they just moved on straight away. So that was difficult to know how you did. But then I had a completely different experience with other panel interviews where it was flowed. It wasn't structured. So they had an outline of things they wanted to talk about, but it kind of went with what you were saying as well. So they'd ask you follow-up questions, they were nodding, and it just went like a conversation. So that felt a lot nicer. But less and less are doing traditional interviews. There's um, only about 9 medical schools out of all of them that do traditional interviews still. And so this, I think for this year, it included Barts, Cambridge, Glasgow, Imperial, Oxford, Plymouth, Southampton, Swansea, and UCL. But these change every year, so definitely check every year. But that's all I was going to say about traditional interviews, really. And if you have any questions, then just ask. But we'll move on to talking about MMI interviews, because these are the ones that most medical schools use nowadays. And that's because more and more evidence suggests that they're more predictive of undergraduate and postgraduate performance. So how you do at medical school and how you do once you graduate as well. Possibly even more than UKCAT and BMAT. So most universities now use an MMI format, which stands for multiple mini interviews. And rather than just saying that you're good at communicating or you can work well under pressure, you actually have to show them that you are. And how it works is that you rotate around multiple stations. And so rather than coming for a 20-minute interview, you'll come for maybe like a 2-hour slot in the morning, lunchtime or afternoon. And you rotate around different stations. And the number of stations depends between medical schools, so it can be between 6 and 8. And they're roughly about, not 6 and 8, so like 6 and 8 minutes, but you can have up to 10 stations. But it's quite good because you've got 10 chances to make a good first impression. And it doesn't just depend on what one person thought of you or how well you got along with one interviewer, that you get a more rounded assessment of you because you meet 10 different people. So you've got 10 chances to really impress them. And if one of them goes badly, the next station has no idea about how that went. So you can kind of make up for that if any stations that you think didn't go as well. So that's why more places do it. So I'll give you an example of some MMI interviews. So this is what it's like at Manchester. So it's a 7-station MMI, and each one is 7 minutes long. And then you get a 2-minute reading time between each station. And they test things like your ability to communicate, why you want to be a doctor, your previous caring experience, and then matters of medical interest, so things in the news, and ethical and other issues. And then at Birmingham, it's a little bit different. So they also have a data interpretation station where you might have to calculate something and then and then talk about it, and they'll interview you. There's also an interactive task and a debate. But so it does vary from each MMI is different, but the common themes are the same. So there'll always be an ethical scenario. There'll always be testing your communication. You'll generally get a station about why you want to do medicine and your personal statement and work experience. So when you prepare for it, your preparation can apply for all of your interviews coming up. And it can be really hard to prepare for it, as in, especially if you're in year 13 and you've got your A-levels to revise for. Preparing for medical interviews does take time as well. And I remember thinking when I was in year 13, like, I wish I was just like, if I was deferring, then I could just focus on my A-levels this year, and I'll prepare for medical, like getting into medical school in a different year. But actually it really helps if you do make time for it, especially if you're not planning on deferring as well. You just have to find the time during your studies. So go over the common things which always come up, like practicing your communication skills, your work experience, a personal statement, Nhs Hot Topics, and ethical scenarios. So I'll be going over all of that in just a bit later in the talk. And the most important thing is practicing. So it's all fine making notes and thinking about what you would say, but the best thing to do is just practice saying it and putting yourselves in situations that you're not comfortable with, and just practicing it. And a lot of universities say that the best answers are the ones which are spontaneous, but well thought out, not the ones which are obviously rehearsed. So it doesn't really help to just memorize paragraphs anyway. So a tip for the MMI, so when you get to the MMI, for each station you'll have a 2-minute reading time, and usually that 2-minute reading time is more than enough. You can probably read what it says in 30 seconds, but they give you 2 minutes. And it can feel like ages, that 2 minutes as well, because you just want to get started. But what it really helps to do is to plan out, read it carefully, memorize it, and think about what you're going to say. So it's similar when we as medical students do OSCEs. It's a really similar scenario. So we get there, we have a station, and then we have to read it. So it might say, you're the junior doctor on the ward and Mrs. Smith has come with a headache, take a history. So it's similar to the MMI interviews. And what really helps with that is look exactly what are they asking you, who are you in this scenario, are you a medical student, are you a neighbour, are you a doctor? If you get that right, then that's then that just avoids any confusion when you go in. And then ask what actually are they asking you. So sometimes in interviews, students will come in and they'll have read the task wrong, and it's not the end of the world if you have, but it just kind of it just knocks your confidence a bit as an applicant, and then all of a sudden the interviewer, rather than just taking a step back and observing, they have to get involved and make sure that you're doing the right thing. So if you've read the scenario carefully, so you know who you are, exactly what you'll be doing, and it also helps to memorize the name and the age of the patient and then to use it. So in our exams, we're told to use that patient, memorize the patient's name, and use it at least 3 times in the consultation. So do that in your interview as well. So the first thing you say, "Oh, hello, Mrs. Smith," and then like when somebody uses your name, you suddenly it's really nice, and you think, "Oh, they actually are paying attention." So it's exactly the same in a MMI role play. And in that 2 minutes as well, it's really helpful to just plan out everything you're going to say. So it depends completely on what the scenario is, but if you know that it's going to be a work experience and personal statement station, just plan out what are the main things that you really want to talk about. You won't have time to talk about everything that you want, but just go over the main things in your head, and then once it's fresh in your head, that will come out when you go into the interview. Similarly, if it's in ethics, just go over, think, oh, what are the main principles I want to talk about, or do I have any experiences that I want to say? And it can also help to just practice the very first thing you're going to say, because if that's really smooth and you have a smooth start, then the rest of it will go smoothly and you'll be really confident as well. So what we'll do now, we'll talk about, we'll go through the basic topics covered in interviews. So this will apply to traditional interviews, to MMI interviews, because they do ask similar things, but just in different ways. So in any medical school interview, you're going to get asked, why medicine? And that can be a really hard one, because even though you already know exactly why you want to do medicine, to articulate it in a way that is that just sounds really impressive, is unique, and is concise is really tricky. And I really struggled with that. But the only thing is, only you know the answer to that. They're definitely going to ask you it, because that's the whole reason that you're there. And it's just to practice an answer. Write it down, practice saying it, and it's okay if the way you say it is different every time. That's good, in fact. It's not obviously rehearsed. So just write down some bullet points and practice saying that one. And it's a tricky one, but only you'll be able to answer that one. So practice your why medicine answer, and make it genuine and make it personal. So I didn't really have any particular experience with healthcare or anything that made me want to do medicine. It was more the fact that I really like science, and I like speaking to people, and I loved a job that could combine both of those. So I kind of had an answer, something like that. So it doesn't have to be something completely unique, but as long as it's genuine and it's personal to you, that's all that matters. So then another thing that they'll commonly ask you is, why that medical school? And this is when your research that you've done before you apply is really, really important. So if it's a PBL medical school, obviously everybody is going to say, I love PBL, it really suits me. Every single person is going to say that all day. So you need to say something that's going to make you stand out and show that you've gone kind of above and beyond just knowing what the course is like. So look at the course in detail. It's hard to understand when you're looking at different medical schools and you're looking at 4 medical schools and you're looking at their curriculum, and it all just sounds the same, and it's a bit confusing with the phase 1, phase 2, preclinical, clinical, and it doesn't really mean anything to you because you don't even know if you're going to be going there. So that can be quite hard, but what is useful is to read it, understand it, and actually picture yourself going there for 5 to 6 years, and this is what you will be doing. So are there any aspects that really stand out to you? So in Manchester, there's an Erasmus course, so where you learn a foreign language on the side from first year all the way to 5th year, and then you go away for 4 months to that country. So that's unique to that university. So if that was something you're interested in, then definitely say that. I remember in Newcastle, for my interview, I'm not sure if they still do this, but they had a module where you follow a pregnant woman from first year and you follow them for a whole year. And that was really interesting to me. So I said that in my interview. So if there's anything that stands out like that, then mention it. Obviously, make sure you know exactly what you're talking about, because you'll be speaking to people who are involved in the course, so they know exactly what it's about. So make sure that you're not just making it up a little bit. So read it. You can always, if you know anyone at that university, speak to them, see what they say about it. But saying something specific about the course like that can make you stand out. Other things you might mention are kind of like intercalation opportunities. So do they have like a bunch of masters that are really interesting that other universities don't offer? Or is it maybe that the university's research focused? Anything that you're going to add to the university is useful as well. So maybe if you're really good at sport, is that university, do they give you time to practice football, and that's why you want to go there, because you want to be on the team. So that kind of thing, if you can weave in what you're going to add to that university, then that helps as well. Something that I often got asked about medical schools is that, do you know, are you aware that placements might be really far away, and is that okay with you? So it's worth just having an idea of kind of where the placements are, because in most medical schools there's at least one hospital that is really far away that you get sent to. So sometimes they check, do you know about that? Is that okay with you? And if you can just kind of say, yeah, I completely understand that, and it's and I'm definitely happy to go. And it's just being aware that you have to go to where the patients are. The patients can't always come to you. So that's just the nature of the course. And so if you're just aware of that and you understand that, then you can say that in your interview as well. Another station that is probably going to come up is work experience and personal statement. And if you get this kind of question or this station, then you are winning, because this is a great one. And this is so easy because you should know it all, and it's what you're passionate about and it's what you've been doing. So a lot of applicants say that they struggle with timing on this one because there's so much you want to say. This is what you're passionate about. You know all the answers to this one. But the thing is with this one is that it is really, really easy to get carried away and just talk about things, but always link it back to exactly what they asked you. So if they've asked you, give me an example of when you were caring, always link it back to exactly what they asked you. But this one's quite easy. So you just show your enthusiasm, your passion, talk about the experiences which meant a lot to you. And kind of before you go in, think about which experiences that you want to talk about are the most exciting, the most unique, because the interviews have to sit there all day listening to people doing quite similar work experience. So if you say something that is a little bit different, if you have anything, then that can be useful. Sometimes find out, do they have your personal statement or not? So it sometimes tells you on the medical school website. If they don't have your personal statement, then you'll have to tell them kind of all the things on it. If they do have your personal statement, you can just mention it and then kind of expand more on it. So sometimes just see if you know whether they have your personal statement or not. Yeah, so then another thing that gets commonly asked is NHS Hot Topics. So this kind of thing is anything that's been on the news or anything just happening with the NHS. So things like any ethical cases that have been in the news recently, any new studies that there are, anything that's been on BBC Health, and things on ethics like funding non-essential surgery, the NHS structure. So trying to understand that, which is really, really dry, but just you might get asked that. So things on like how the NHS structure is changing, that kind of thing. So for this, it really depends on kind of what stage of your application you're in. So if you've got an interview coming up next week, and you're not really sure about the latest in health news, it gets a little bit tricky because you have to, you're not just going to get asked things, the latest things, you get asked things over like the last year or even more than that. So this is where starting early is really, really important. So if you've got time, so if you're maybe applying next year or the year after, then what you could, a good thing to do now is to kind of just check BBC Health every day. So you can do it after you check, same as you check any other social media, like after you check Instagram, Snapchat, like go on BBC Health and just have a quick read on what are the latest news articles. You don't have to go into them in detail, but just to be aware, is there anything major going on? If you read that for a minute every day, that will just kind of keep you up to date with what's going on. And when, like, an excellent thing to do if you have time would be maybe once a week is to just take one health story that you see and just write it down. Maybe do a little bit of further reading on it, and just get an understanding and why you find that interesting. And if you do that for a week, then you'll have a whole collection of interesting cases, and you'll just feel really knowledgeable. So when they ask you any question, you have a really good understanding of what's going on, to be able to answer that question really well. So that's something you can do if you have time. A really good resource actually is NHS Choices Behind the Headlines. And I'd recommend that even over reading BBC Health, because what that is it takes news articles which are in the news every week, and it explains them simply, but it also actually tells you, if it's like a new study, it tells you what kind of study it was, what is it, a good study, is this good research, what further research is happening. So that's really excellent for if you're applying for medical school, because that's the kind of thing you want. You don't just want the news as it is, you kind of want to analyze it a bit more, and that kind of does it for you. So that's really interesting to read and keep up with. And then other things that you might commonly get asked with NHS Hot Topics maybe is kind of funding, anything else in the news like junior doctor contracts, the pressures on A&E in the winter, all that kind of thing. Yeah, so if you've got time, do that over a long period of time, and then that will really make you stand out. If you don't have a lot of time, then just kind of maybe go through that NHS Choices Behind the Headlines, and go through some of that, because that would be really interesting as well. So now we'll talk about medical ethics, and medical ethics will come up in your interviews in some form or another, definitely. And you can get a range of different types of questions. So I'll give you some examples of questions so you get an idea of what kind of thing you might get. So you might be given the age, gender, the occupation, and the background of 5 people, and you have to choose 2 people who are given a life-saving heart transplant. Or you might get something like, you're the junior doctor in a hospital, and you notice that your supervisor, who's a consultant doctor, has come in and he appears to be drunk and dishevelled. How would you approach the situation? Or you might get something like a 14-year-old girl comes to you for contraception advice, or a Jehovah's Witness needs a blood transfusion. So there's lots of different ethical scenarios that you might get, and it's hard to prepare for every single one. But what is really good to do is to get an idea of all the principles behind it. So a good book that I read was Medical Ethics, A Very Short Introduction. And it was a very short introduction. It was only about that thick and like this size. And especially if you've never done philosophy or anything like that before, that was really, really useful because it just explained it to you briefly, and it didn't go into a lot of detail on the history or where this ethics came from. It explained it to you really easily, and it also applied it to scenarios as well. So that book was quite helpful, but just gaining an understanding of the basic principles, so things like the 4 pillars of medical ethics, consent, capacity, your rights, your legal rights, your right to refuse treatment, and how does this conflict with your with the responsibility as a doctor and the Hippocratic Oath that you take. And the key with medical ethics questions is that often there's not a right answer, and often the medical school, they're not going to take a stance either way on what the right answer is. But what you need to do is you need to give a detailed explanation and give both sides of the argument. And the most thing is it has to be an explanation. So anything you say, back it up with what you know, like any other principles that you've read, talk about how it conflicts with other medical ethics principles. You can even bring in any situations that you've been in, maybe, where you've kind of seen that in real life. That's the best way to approach it. And it doesn't matter if you don't come to an exact conclusion at the end of it. And it's okay if you kind of say conflicting things, if you conflict with yourself when you're giving your explanation. But more important is to just to give a good explanation of it, really. So yeah, reason both sides, explain your thinking and back it up with principles is probably the key to medical ethics scenarios. And do some research, do some reading on that. Do some reading on it, because sometimes it's hard for you to know what the right thing is to say. And sometimes when you see practice questions and answers, it gives you an idea of what are the kind of things you might mention that you wouldn't have thought of by yourself. So getting an idea of medical ethics in general, so maybe doing some reading on it, and then also looking at practice questions and answers can be really useful for these kind of scenarios. And at the end of the day, you might not get a question that you've prepared for exactly, but if you've done lots of similar questions and you understand the basics of it, and you can apply it, then that will get you through medical ethics scenarios. So now we'll talk about questions such on empathy, insight, and your personal qualities. So typically you might get a question like, give me an example of teamwork, or give me an example of when you were caring, or you had to experience some challenging communication. And they're questions about you as well. So what are your strengths? What are your weaknesses? Typical questions like that. And with these kind of questions, the most important thing is to be genuine and to be honest. And to not put yourself down. So a good book that I used when I applied was the ISC Medical Interviews book, which goes through loads of different interview questions, and it gives you kind of good answers for them. But the best thing is that don't use it word for like, you don't have to memorize the exact paragraphs that they give you, but just that the way they answer the question is just it's just interesting to see, and you see, oh, okay, that's a good way to answer it. So you can take some tips from that. So that was really useful. So for example, if you get asked what your weakness is, it's important that you don't just put yourself down and just say negative things about yourself, but equally, you shouldn't, some people say, they say a weakness that isn't really a weakness. Like, I'm a perfectionist, so when I'm working out, I always have to make sure it's absolutely right. That's not really a weakness, and almost everybody will say something like that. So the way to do really well in these kind of personal insight questions is to be genuine and to be honest, and to give an explanation of kind of how you realized you have what your weakness is, how you realize that you have that weakness, and how it affected you, and most importantly, what you've done to address it, and what you do at the moment to stop that being a weakness for you. So in the end, you've kind of turned that question around. You've answered their question that, like, what is a weakness, but you've given them something positive about you. So that's a good way to answer your weakness style questions, and that's why interview books and that can be really helpful for those kind of things. So now we'll move on to talking about role play. So this one's specific to Mmi interviews, really. You probably won't have to do any role play in any traditional interviews. But the role play can completely vary, and it can be a bit strange because it's not something you're used to doing, and the whole scenario can feel really artificial. But the thing with role play is to take it seriously. So with role play, they usually get people who are actors in like Hollyoaks or something, or usually actors who are involved with the medical school to do a lot of simulated patient work. So they're good actors, and you have to take it seriously. So that's the way to do really well in these stations, because once you get to medical school, you'll be doing a lot of simulation and role play when you're doing kind of consultation skills, and then you have to take it seriously then. So they'll expect you to take it seriously in an interview as well, even if it feels really weird. So the kind of things you might get is you might get a Breaking Bad news station. It might be medical, it might be not medical at all. So it could be something like you accidentally run over your neighbour's car while you're reversing. Like explain this to your neighbour, or maybe speaking to a patient who's just been diagnosed with Alzheimer's, or anything. Like, it can be absolutely anything. And what they're really testing is kind of your insight, your integrity, your empathy, and your communication skills. So it's hard. It can be tricky, but you have to throw yourself in. And most important, this is when your work experience and your voluntary work and everything will kind of come into use, because if you're used to speaking to patients, or just people in general, then this will really pay off in these communication scenarios. So some things you might do is you have to read it really carefully. So I mentioned earlier, before you go and think about who are you speaking to, what's the aim? Is it a patient? Is it a nurse? Is it a neighbour? Who are you? Make sure you get all of that right and use their name. And then they're also looking at not just your verbal communication, but your non-verbal communication as well. So sometimes in our exams, they'll keep the patient somewhere, and then your chair is really far away, and it's not great for your communication. So it's good. They notice if you kind of move your chair and move your body language to kind of facilitate that conversation a bit easier. So make sure, like, move the chair if you need to, so you can actually speak to them. And mirroring is useful as well, so depending on the situation. So if they're really upset, they're really low, and they're really sad, then kind of mirror how they're speaking, bring your tone down, speak slower, nodding, that kind of thing. So that kind of shows your empathy in your non-verbal communication. And with role play, the only way to kind of be good at it is to practice. And what a good way to do it is if you practice in groups of 3, and one of you is the examiner, is the interviewer, one of you is the student, and the other person is the actor, and then just rotate round. And it's useful you practicing, but it's also really, really useful to watch other people practice, and to also for you to be the examiner, so you can see what's really good and what's bad, and you can kind of see from their perspective. So that can be really useful. Yeah, I think that's it for this one. And another thing is practice with people, practice with your friends, practice with your family, but also it can be really useful to practice with people that you're not completely comfortable with. So maybe a chemistry teacher who's a little bit scary, but wants to help. It can be really useful practicing with people that you're not completely comfortable with, or maybe other people in your school, like maybe if you have a medical society, people you don't know as well, because that's what it will be like in your interview. You're not going to be completely comfortable. So if you can do well in that kind of scenario, you'll find you're really confident when you come to your interview. And I think that's it for the role play. So if you have any questions at all, then ask on the side as well, and then we'll come back to them at the end. So another MMI scenario that you might get is calculations. So they don't do this one at Manchester at the moment, but they do it at other medical schools. And this can be something like data gathering. It can be like doing some quick mental maths and having to do some conversions. For example, they might give you the weight of a patient, the dose of the medication. They might say you've got a syringe containing this X amount of milliliters. So what volume of solution in the syringe do you need to administer? So it's just doing some mental maths quickly and under pressure, which can be tricky. Or it could be some kind of data interpretation. So it could be something like you may be given a graph of blood sugars in a diabetic patient and then seeing how they change over the period of 24 hours. And you might just have to interpret it. And or you might have an image. So you might have a patient of it's a face and they've got an eye injury, and then you have to interpret that image. So the way to kind of tackle this one is to don't just go for the most obvious thing you see. Take a step back and start with the basics. So if it's a graph, say, so go for what's the title, the date, what are the axes, what is the graph showing, what type of graph is it, is there any relation or any correlation that you can pick up on, how can this be explained physiologically, are there any anomalies that you can pick up on. So if you take a step back and go through all of these at the beginning, even though they seem really obvious, you'll score points for going through it systematically. Similarly with an image, if it's clear they've got a huge trauma to their eye, it can be really tempting to just talk about that. But take a step back, say, who's the patient, what's their name, date of birth, when was the image taken, what is the image, is it an X-ray, compare it to normal, and then give some kind of explanation for it. So they're not necessarily testing your ability to interpret an X-ray, but just to look at an image and gather some data in a systematic way. And yeah, so you might get that kind of data interpretation station as well. So it's worth having a practice of the different scenarios that you might get. So another thing that sometimes MMIs have, they might have like a creativity and imagination one. And even in my panel interviews, I had some questions like this. So in one interview, I got asked if I was going to open a primary school, what would it be like? So sometimes you just get strange questions that are testing your creativity. Or you might get something like a task which tests your dexterity. So you might have to like do a mini procedure where you thread a large needle in sterile conditions. Or you might get asked without using your hands, explain how to tie a shoelace. So these ones are tricky because you can't really prepare for them, but it's just being aware of the different types of things that you might get in those kind of scenarios, so it doesn't completely throw you. Okay, so for the last bit of the talk, I'm going to just go through some hints and tips from my experiences, from the experiences of other people, and then I'll go through it if there's any questions at the end. So the first thing I would say is try and keep the morning of your interview as stress-free as possible. It's already a really stressful day, so if you can, obviously leave your house early. For almost all of my interviews, I went the night before because they were quite far. And if you can do that, then I recommend doing that because you just have a really relaxed evening. You can just read over your notes if you like. In the morning, I usually stayed quite near to the university, so I got to have a breakfast and wander over there. And then I usually went with my dad, so having somebody there who was just kind of calm and not stressing me out more was really helpful for me. So if your interviews are quite far, then consider staying the night before. For one of them, I didn't. So for my Manchester interview, we were driving up on the morning, And then there was loads of traffic on the motorway, and then there was a car crash ahead. So what we had to park our car in the nearest train station and then get the train up because we were worried we weren't going to make it. So give plenty of time. And if the worst does happen, if there is a car crash, if there's an emergency, or if you're ill, just contact the medical school or the interview team as soon as you can, and then it should be fine. They'll be able to fit you in at a different date, but as long as you've contacted them, so don't give up and say, oh, I can't make it. Contact them as soon as you know, because they should be able to make some different arrangements for you. Another thing is that first impressions really count, and they make a huge difference. And I saw that when I was in the interview. So walking in really confidently and smiling, just looking, even if you don't feel confident, just pretend that you are and just smile and go in. And if you usually shake people's hands, then shake their hand. If you don't usually do that, then you don't have to. It might just feel really fake and forced. So do whatever feels natural to you, but just smile and just pretend that you're really confident and at ease. Because it just makes a huge difference. And another thing is, don't overthink how the interview went afterwards, which I'm definitely guilty of. After every single interview, all I could remember was all the bad things that happened, all the questions I didn't answer well, and I cried pretty much after all of them. But just try and remember the positives, and don't let it get you down or distract you from any other interviews that you've got coming up, or let it knock your confidence, because honestly, it's so hard to say how you did. You just have no idea. And especially with the MMIs, even if you think one went badly, you've got like another 9 stations that they take an average from. So don't let that worry you too much. Another thing I experienced in my interview was the good cop, bad cop, and sometimes it was just a bad cop. For example, like some interviewers I had, they were really nice. They were nodding, smiling. They were asking me questions. They were asking me follow-up questions to what I was saying, so they were interested. Some other interviewers, they weren't even making eye contact. They were really abrupt. They didn't look impressed with my answers at all. But just don't let it faze you. It's either they're just like that as a person, and they're doing that to everybody, or they're having a bad day, or they're just trying to see if you can handle the pressure. So don't let that kind of thing faze you, and still look at them, still smile at them as well. So don't let that put you under pressure. A common thing I was worried about when I had my interviews was what happens if your mind goes blank and I just have no idea what to say to their question, and what do I do in that scenario? And that I was really worried about that, and that actually never happened to me in any of my interviews, because once you get started, the adrenaline just kicks in and you just keep going. But if that does happen and you genuinely have no idea how to answer a question, then what you can do, you can take a moment, and it feels a lot longer to you than it does to the interviewer. But you can take a moment to think about what they said. You can ask them to repeat it. They may just repeat it word for word, or they may paraphrase it. If you still don't know what they mean, you can apologize and say, oh, I'm sorry, I'm not exactly sure what you mean by that. Could you explain? And that's okay to do as well. If you still don't know exactly, you still have no idea what to answer that question, you've never even heard of that before, you don't know what to say, there's 2 approaches. You can either apologize and say you don't know, but you'll go away and you'll have some reading, which is honest, but it's not the most impressive answer to them, because when they're in their sheet, they can't really give you anything for that. But what you can do is you give some kind of answer, as long as you're not talking rubbish. But this is your one chance of getting into medical school, so you have to give it a shot. So don't make up some rubbish, but just give some kind of answer that you think might be useful. And hopefully they might direct you if you're talking about something else. But give it a go, say something. Another thing, what to wear something comfortable, wear something smart. So wear something, if you're unsure about 2 things, wear the more smarter one, because everybody comes dressed in proper suits. But the most important thing is for you to be comfortable. So if it's a brand new suit or a brand new dress and you're feeling a bit awkward in it, or a bit uncomfortable in your new shoes, maybe just wear it a few times beforehand and just practice, just get yourself used to being in it. Alternatively, just wear something that you find comfortable. That's not revealing and not controversial at all. And sometimes avoid things that you fiddle with. So especially when you're nervous, you might play with your bracelet or like a necklace or something. And when you're talking, you want the interviewer to listen to what you're saying. And if they get distracted by you just fiddling with your ring, taking it on and off, they're not listening to the amazing things you're saying. And it just shows that you're a bit nervous and you're not totally comfortable. So avoid anything that you might potentially fiddle with. And lastly, the interviewers want you to do well. It's a scary situation, but they do want you to do well, whether this comes across or not. And the fact that you've got to the stage of getting a medical school interview is amazing. And if medicine is what you're passionate about, it's what you want to do, you've done your research, then don't listen to the horror stories, because you've got a really, really good chance of getting in. They just want people who are nice, they're friendly, and they're genuine, and they've done their research into medicine as a career. So if you've done that, you'll definitely do well at interviews. So that's everything from my talk. We'll see if we've got any questions at the moment. Let me just see. I'll just check if we've got any questions. Okay, well, I think that's it. Hopefully that was useful for you. If you do have any questions, then just email into Medic Mentor at any point. And thank you. Bye-bye.